If you are over 60 and you have been feeling more tired than usual, noticing that your ankles look slightly swollen at the end of the day, or finding that activities that never used to wind you are now leaving you short of breath, there is something your doctor needs to know. Because each of those things on its own is easy to explain away. Fatigue from getting older, swelling from sitting too long, breathlessness because you are not as fit as you used to be. And in many cases, those explanations are exactly right. But they are also the four most common ways that early heart failure presents in adults over 60. And the reason heart failure is so frequently missed in its early stages is precisely because its signs are indistinguishable from what most people assume aging simply feels like. Today, I am walking you through these four signs, what makes each one clinically significant rather than incident, and exactly what to do if the pattern applies to you. Welcome back. On this channel, we focus entirely on health after 60, because at this stage of life, the difference between a symptom and a sign of something serious is a distinction that matters more than it ever has before. Heart failure is not a sudden event. It is a progressive condition in which the heart gradually loses its ability to pump blood efficiently enough to meet the body's demands. It affects approximately 6.7 million adults in the United States, and its prevalence increases dramatically with age. Roughly 1 in 5 adults over 65 will develop heart failure during their lifetime. What most people do not know is that heart failure has two distinct forms. One involves a weakened heart muscle that cannot contract with enough force. The other, far more common in adults over 60, involves a stiff heart muscle that cannot relax properly between beats, reducing the volume of blood that can fill the ventricle. This second form is called heart failure with preserved ejection fraction, and it is far more likely to be missed because the ejection fraction on an echocardiogram may appear normal, while the heart is already failing to meet the body's needs. The four signs we are about to discuss are particularly associated with this form. Let us go through each one. Sign number 1. Fatigue that is disproportionate to activity. This is the sign that is dismissed most consistently and most consequentially. When the heart cannot pump efficiently, the muscles and organs receive less oxygenated blood than they need. The body compensates by redirecting blood flow to vital organs and away from non-essential functions. The result is a persistent, pervasive fatigue that does not have a clear cause and does not improve with rest or sleep. The distinction that matters clinically is this. Ordinary aging fatigue is related to activity. You do more, you feel more tired. Heart failure fatigue is present even when activity has been reduced. It is the fatigue of insufficient delivery, not of excessive demand. The person finds themselves needing to rest during tasks that previously required no effort. They sleep more without feeling more rested. Their energy has a new and lower ceiling that does not respond to the usual remedies. After 60, this pattern is almost universally attributed to age, anemia, thyroid problems, or depression. All of those are legitimate possibilities and should be evaluated. But heart failure belongs on that list as well, and it is frequently the last thing investigated rather than among the first. Sign number 2. Ankle and leg swelling that is worse in the evening. This is perhaps the most recognizable physical sign of heart failure and simultaneously one of the most commonly dismissed. When the heart cannot pump blood forward efficiently, blood backs up in the venous system. Fluid leaks out of the blood vessels into the surrounding tissue. The result is edema that accumulates over the course of the day and is most pronounced by evening. Pressing a finger into the swollen area and releasing it may leave a temporary indentation. This is called pitting edema, and it is a specific clinical finding. After 60, ankle swelling is attributed to standing too long, heat, medications, or venous insufficiency, all legitimate. But heart failure, edema, has a distinguishing pattern. It tends to be bilateral, affecting both legs equally. It worsens progressively over weeks rather than fluctuating with activity, and it is often accompanied by measurable weight gain from fluid accumulation. A gain of 2 or more pounds over 2 days in an older adult with any other symptom on this list is a recognized warning sign that cardiologists use to monitor for heart failure decompensation. Sign number 3. Shortness of breath with activities that previously caused none. When the heart cannot maintain adequate forward flow, pressure backs up into the pulmonary circulation. Fluid begins to accumulate in the lungs. The lungs become less compliant. More muscular effort is required to breathe. The result is breathlessness with exertion that develops gradually over months. The behavioral adaptation this produces is clinically important because it delays diagnosis. The person takes the elevator instead of the stairs, walks more slowly, does less. And because they are doing less, the breathlessness recedes from their awareness. They are not dishonest with their doctor. They have simply adapted to a new and lower functional ceiling without recognizing it as a symptom. A question every older adult should ask themselves: are there activities I have stopped not because I chose to, but because they have started to feel too hard? If the answer is yes, and the reason is breathlessness, that is a clinical finding regardless of whether it has been reported. 2 specific patterns should be reported to a doctor immediately. Orthopnea is breathlessness that occurs when lying flat and resolves when sitting up. It happens because lying down redistributes fluid from the legs to the lungs. Paroxysmal nocturnal dyspnea is waking from sleep with severe breathlessness that resolves after sitting up for several minutes. Both are classic features of heart failure, and neither should ever be attributed to normal aging. Sign number 4. A persistent cough or wheeze with no obvious respiratory cause. When fluid accumulates in the lungs as a result of heart failure, the irritation produces a chronic cough. It is dry or produces a small amount of white or pink-tinged frothy mucus. It tends to be worse when lying down and improves when sitting up. It is not associated with fever, sore throat, or the features of respiratory infection. In older adults, this cough is almost invariably attributed to post-nasal drip, acid reflux, or a respiratory condition. Frequently, one of those explanations is correct. But when a chronic cough occurs alongside any combination of the other 3 signs on this list, the heart belongs on the list of possible causes and should be evaluated specifically. One additional consideration: ACE inhibitors, among the most commonly prescribed medications for heart failure and hypertension, cause a dry cough as a side effect in approximately 10 to 15% of patients. This means the cough in an older adult on an ACE inhibitor may be caused by the treatment rather than the condition itself. Your doctor needs to know about the cough regardless of its apparent cause, because the distinction matters for management. If any combination of these 4 signs applies to you, here is what to do. Schedule an appointment and describe each symptom specifically, including how long it has been present and whether it is worsening. Request an echocardiogram. This is the test that evaluates heart structure and function, and it is essential for diagnosing both forms of heart failure. Request a BNP or NT-proBNP blood test, which measures a protein the heart releases under strain and is elevated in heart failure even when the echocardiogram appears relatively normal. Request a chest X-ray if pulmonary congestion is suspected. Heart failure is a serious condition, but it is also one of the most manageable chronic conditions in medicine when it is caught early. The treatment options available today have transformed the prognosis compared to even a decade ago. What has not changed is the importance of catching it before the damage becomes irreversible. Which of these 4 signs do you recognize? Leave a comment below. I read every single one, and your experience might be exactly what someone else watching this needed to hear. If this was useful, share it with someone over 60 in your life. Heart failure caught early is heart failure that can be managed. Missing it is the outcome we are here to prevent. And if you are not subscribed yet, new videos every week focused entirely on health after 60. No ads, no products to sell. I will see you in the next one.